Hi everybody, good morning. Welcome to our second video. Our first video we did specifically for EMS providers and sharing best practices. In this video we want to share with the community that we serve some practices that they can expect to see by EMS providers when we respond to 911 calls. We're doing this because it's a means of protecting ourselves, protecting the patients that we come in contact with, and protecting our families. We don't want to become carriers that promulgate this virus any further than it has already come. We have finite amount of employees and resources, and if we begin to become ill and quarantine, then that's going to mean less ability to provide the service that we continue to provide every day in our 911 system. There are many patients in the community that are carriers and that are not diagnosed. And while this is going on, we still have our normal 911 calls that we're responding to. That has not stopped. So the precautions that we are taking is to keep ourselves safe and the community and our families safe. So we're going to share some of those practices today to hopefully put you all at ease on what to expect when EMS arrives. Today I have my peer from the Operations Division, Captain Alex Morisano, who is the director of our 911 response side of the service. And Alex is going to answer some questions for us. So I think one of the first things I would say, and we can talk about, is our distancing here. Talk about the practices you guys have implemented on the operations side when employees arrive to work.
Sure, yeah, so sure, first and foremost, you can see we're holding masks. And I think for the purposes of this video, we are not wearing masks just so you can hear what we're saying and you can potentially read our lips when we're talking. But we're obviously maintaining a good 6 feet distance here. Normally, when the crews, EMTs and paramedics come into work, they are wearing surgical masks all the time when they're in quarters. And in addition to that, they're wearing surgical masks when they go out into the public, into buildings that they are not responding to calls on, i.e. going out to get food or going into the hospital. And so what that does is protect the providers from potential people that are out there that are either contagious and they don't know it yet, or are contagious and perhaps will never experience symptoms from that. So it's a little bit uncomfortable for our staff to get used to that, but at the end of the day, what it does is protect everybody from cross-contamination. With that, every shift that an employee comes into work for, they are getting a screening done and they are getting a temperature and questionnaire completed. Okay, that's at the beginning of the day, if their shift starts in the morning, or at the end of the day if their shift starts at night. And there's a whole qualifying questionnaire that goes along that we're going to explain in a few minutes that will help us either ensure that the employee is good and safe and healthy to come to work, and also perhaps if they are experiencing symptoms that may make us concerned and possibly have them take the day off.
I think another thing that's come up that maybe some of the residents would want to know is when they dial 911, they speak with a telecommunications operator, dispatcher. What takes place? Is there a delay? Is there a screening process?
In this community, as well as in New England and across the United States, there have been certain modifications made to the way a call taker responds to questions when someone dials 911. With that, there are several questions that they will ask related to symptoms of cough or illness or fever that will help the call taker and dispatcher decide whether that person may be a potential carrier or patient that the EMS responders, the paramedics and EMTs that are coming to your home or to your location where 911 was called, need to take precautions to protect themselves from potential cross-contamination of the virus. That's good.
Yeah, so, and during this process, I assume the call taker has an ambulance moving towards the 911 call while they're asking these questions. There's not a delay.
Right, during that process, just like on any other normal day, when the questions are being asked, there's a dispatcher dispatching the ambulance to the call. The wheels are rolling to that patient, and information is being updated during the whole process through the radio or through a computer-aided dispatching program.
Yeah, so I guess the message would be that it's good for the residents to know that even in time of an emergency, as frustrating as can be, these questions are super important, and that help is on the way. It's not being delayed by any means by asking these questions. Is there something that happens with the providers when they arrive on scene as far as PPE that patients can expect to see?
So when providers are showing up to the scene of an emergency, they are 100% of the time wearing N95 masks. Okay, what this does is it protects the providers from the potential patient and or bystander that might be infectious, okay, but not showing symptoms, okay, not having the normal cough or fever, etc., but they might still be carriers of the virus. So we take precautions to protect the paramedics and EMTs that work for New Britain Emergency Medical Services to the level that they are 100% protected. And that is even for responses to situations where people may not have a fever, a cough, difficulty breathing, etc.
Should the patients expect to have any form of PPE put on that?
So in addition to the employees of New Britain EMS wearing N95 masks, what we also are doing 100% of the time is placing a surgical mask on every patient. Okay, and what this does is reduces the transmission of a potential contagious patient by a significant amount. And this helps not only the providers in the back of the ambulance, in a close quarters in the back of the ambulance from droplets being sent out into the air, but it also helps when we are going into the hospital, okay, and in the hallways of the hospital when we're bringing patients into the hospital.
As far as anyone that's interested in doing business and stopping by the EMS headquarters, what are your recommendations and what are you allowing people in the city?
Right, so in terms of visitors into the building, at this point in time, we are only allowing official business to take place inside the quarters, and what that basically means is official government, representatives of official government agencies, and or critical deliveries that we need to have take place. At this point in time, we are not doing any car seat fitting, and we are not allowing the general public into the building. What I'll say is that when we are allowing officials to visit the building, either they have to have a protocol in place for clearing their employees for a daily fitness and duty, meaning they're taking a temperature and a questionnaire, and or we will do that for the visitors here. The same process that we use on our employees every day and every night. And with that goes wearing a surgical mask while they're in our quarters. And this is mainly just for the protection of everybody involved, the visitors as well as employees at New Britain EMS.
If someone, and I don't know if the general public knows, but we get frequent amounts of walk-up 911 complaints to our facility. If someone is coming to EMS headquarters to activate the 911 system as a patient, what should they expect?
Right, with that, we have signage on the doors that basically explains that process. And the person would ring the doorbell. They are asked to step back 6 feet from the door, and then we would essentially react to this call the same way we would react as if we were arriving on a 911 scene, and you know, donning PPE, asking the same questions that we would ask to the people that we would be arriving on a 911 scene. And some of that, you know, might involve questions regarding, you know, cough, fever, shortness of breath, and any other sort of symptomology that might present with someone who might be experiencing COVID-19.
And I think it's important to remember that while we're donning PPE for all patient encounters, the screening still needs to take place for a global view of what's going on. And the second piece of this puzzle that happens is our communication with the hospitals and receiving facilities. If we have someone that screens positive for a potential high risk of COVID, it starts a different process of triage and receiving at the hospital to reduce exposure and potential transmission at the hospital. So that's another reason why we ask those questions. Well, part of what Captain Morisano does, managing the 911 side, is he's charged with maintaining all PPE supplies that come into the organization. So with that, I'd ask, are we experiencing what we're hearing about in the media with the PPE shortage? Is it affecting our providers?
You know, what I'll say is that there are major shortages throughout the healthcare community, and New Britain EMS is not immune to that. On a daily basis, we are struggling to find PPE supplies, you know, masks, gloves, gowns, face masks. It's a constant struggle, to the point that we are currently practicing N95 reuse, which is approved by the CDC, although not the ideal circumstance for us to use on a daily basis. With that, the N95 mask is placed in a clean paper bag after each use, and then the provider is using that N95 again throughout their tour. You know, we have been approached by several citizens of the community asking if we can give out personal protective equipment to them, and you know, I think the only way to address that is by suggesting that the PPE is most important to healthcare providers because they are the ones who are most at risk in the current situation. And the supply chain is so fragmented that it would be irresponsible for us to be giving out PPE to people who are not healthcare providers.
So I would say there's a second piece to that, and it is that, you know, paramedics, EMTs, healthcare workers, doctors, nurses, police officers, firefighters, we are all essential employees, and that means that we are obligated to continue to do what we're doing in this time. And we are very up close and personal with the public. So there is no social distancing for us in these situations. So we do need this PPE. I would say the lay public has the opportunity to practice social distancing as recommended by everybody. You can stay 6 feet away from each other. You can reduce the amount of people to less than 5 that are in an environment. We don't have that ability. We have to come here. We have to work through this, and we have to risk getting sick and infected. And most of us know that that is probably a reality. So the PPE is definitely needed here at us. So I think what we're going to do now is we're going to set up, and we're going to show you some of the process that we have in place as far as PPE and screening. Welcome to work. Just got a quick health screen for you here. What was your temperature?
98.0.
How are you been feeling today? Okay.
Okay.
You put in what time the temperature was taken. And I took it.
11:41.
All right. Have you been in close, unprotected contact with anybody that's been sick in the last 48 hours?
I am not.
Have you had any sore throat, chills, digestive issues, or shortness of breath?
I am not.
Do you have a cough currently?
I do not.
Have you been taking any cold medicine?
No.
Have you been taking any antipyretics, aspirin, Tylenol, ibuprofen, anything like that?
All right, great. Welcome to work. Thanks for coming in.
Happy New Year.
Rich, how you doing?
Good.
All right. Just fill the date and time out here.
So we've enlisted the help yet again of paramedic Maloney and FTO Mora to demonstrate what the process looks like when we get our PPE on and what the PPE does effectively. We'll talk. Now, for the purposes of the video, Rich is wearing a surgical mask. Normally, when he arrives, he'd have an N95 that he would don. Normally, he would have an N95 that he was on, but Ashley is showing you that process right now. She has an N95 particulate respirator on with a surgical mask and face shield covering that. Underneath the face shield, she has protective eyewear on, and she has a contact precaution isolation gown that she's wearing and that Rich is tying for her. So I think one of the questions that come up when we talk about this is what is the difference between droplet-borne ailment and airborne? So the fact of the matter is, yes, this is a droplet transmitted virus, but the piece of that is it's really a thought of difference in nomenclature, right? Those droplets can become aerosolized and they can become airborne. Any particle less than 5 microns is considered a droplet nuclei, and that is what's considered an airborne particulate, okay? That can happen with COVID when we're doing medical procedures, so intubation, nebulized treatments, bag valve mask ventilations, okay? And it can happen during the process of coughing and sneezing. So while COVID is droplet-borne, it can also become aerosolized and become airborne. In the droplet form, it's greater than 5 microns. It's much heavier. It's more likely to fall to the ground quicker, okay, as a particle. But again, that can become aerosolized into airborne during certain procedures and during coughing, sneezing. The other thing that we want to talk about is a difference. So an N95 respirator is designed, and Ashley, I'll ask you to take off your surgical mask. This is an N95 respirator, okay? To wear that, you need to be fit test, and you have to perform a pulmonary function exam to say that you can wear that mask without any detriment to you as the individual. And then each of our providers gets a special fit test that goes with it. The N95 masks are designed to filter a much smaller particulate when we start talking about airborne type things, okay? We do not put N95s on patients, okay? The patients get the surgical mask, which is what Rich is wearing. The surgical mask offers, Alex, the CDC says what, roughly 80% effective protection from droplet and everything?
By placing the surgical mask on a patient, the idea is that you're reducing the percentage of transmission by roughly 80%.
Okay. So the surgical mask is not as fine as a particulate respirator as an N95, okay? It actually isn't. It's a barrier device. You'll see that it's, I don't want to touch his face, but it's loosely fitting, okay? And it offers a shield for any droplet-borne particulates that may come out of the mouth, nose, etc. Whereas the N95 can filter a much finer particle. Again, N95s are not going on patients, okay? The N95s are reserved for the healthcare providers, and the surgical mask is what we are putting on patients and wearing under normal conditions within our facility. The other piece you'll see are gloves. Gloves are part of our standard PPE that we wear on a daily basis doing 911 calls. They're just a protective barrier device. These are nitrile gloves. They are not anything that anyone has to worry about as far as latex allergies. And then it's an isolation gown that we have on, which is a standard isolation gown, which covers the provider's clothes. Because this is droplet-borne and we're in a much closer distance than 6 feet, even though we're taking the precautions with the surgical masks, we still want to cover our clothing so that our clothes don't become contaminated, or at least are protected the best we can from becoming contaminated. And the last piece would be the eyewear. This can be transmitted and contracted through eyes, nose, mouth, so our eye protection is essential. When we're doing procedures like intubation, airway management, we'll have that surgical mask that Ashley had on with a shield on it over our N95 to offer additional eye protection to protect the N95 so we can reuse it if it's a low contamination risk. And we also have a much larger face shield we can wear during intubation procedures. This is pretty standard. Most healthcare providers are comfortable wearing this. It can look a little intimidating when it arrives at your house, but I assure you, it's really as a means to protect ourselves, to protect the patients, and to protect our families so we don't further spread this virus. And I can also assure you, you saw how quickly we can put it on. It is a pretty quick process to get this on. So I'd encourage you guys, if you have any questions, please feel free to comment below in the comment section, or call us, email us, and ask us if you have any questions or concerns about any of our services or precautions that we're taking. And also, please refer to the CDC website for guidance as it pertains to how you should be functioning during this COVID-19 pandemic.